Doctor, you can start the session. We are live.
We are
We
live?
have, yeah, we are live. We have 120 teams. We are live. We can go ahead, doctor.
Okay. Are there people who are in the queue right now who are yet to log in or who are trying to log in rather? Sai,
10 more, doctor. They will join, I think.
136. So shall we go ahead?
Yeah, you can go ahead, doctor.
Okay. ये बंद करो. Okay. So good evening, friends, and welcome to this second episode, that is second preliminary rounds of this particular Brain Teaser Big Q Season 5. This is episode number 2. So this is a pan-India intercollegiate quiz hosted by Brain Teasers in association with Ophthalmological Society of Nagpur, that is Big Q in its season 5. So this is the famous
आठ समंदर अपना अंबर
साला कुछ
खोज
जीतना
ले
ही
अब
नहीं
तू
which
अपने
must be
दम पर
initially
फूक
going
मार
on
के
last
धूल
5
झाड़ ले छोड़ छाड़ के सारे छप्पर आठ समंदर अपना अंबर खोज ले अब तू अपने दम पर फूक मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर खोल दे पर खोल दे पर खोल दे पर खोल दे पर बंद घड़ी की भी रुकी हुई सुई होती सही दो दफा चुप क्यों है रहना मन का तू कहना रोके चाहे हिचकियां खोल दे पर खोल दे पर खोल दे पर
So once more, good evening, friends, and my pranam to all the mentors. Brain Teaser team welcomes you to this second episode of fifth season of Big Q. As just to introduce to the people who have joined us in this particular season, Brain Teaser is an online quizzing platform for hosting quizzes for ophthalmologists of our country since last 7 years. It was almost 5 years back. The same platform we decided to host to get all the postgraduates from across the country on a single platform to have online exclusive quiz for postgraduate. And with that was born the Big Q. First season, we saw 200 plus teams, and the last 3 seasons, we have an increasing crescendo, and we are every year teams are adding upon, and we boast of having played a maximum 260 teams in the last season. So here we are in the fifth season. Let me thank Ophthalmological Society of Nagpur, the President Dr. Rahul Tiwari of Ophthalmological Society of Nagpur for associating in this season also with Big Q. Remember, the fifth season has 6 preliminary rounds, and today is the second preliminary round. Following it, we will be having 4 quarterfinals, followed by 2 semifinals, and then a final. The episodes will be aired on alternate Wednesdays at 7:30 p.m. again. Brain Teaser team is extremely thankful to the team of Quizmaster who toil hard to create a wonderful experience of learning with fun for all of you. Today's episode, we have Quizmasters were also a part of our last seasons. We welcome Dr. Mamta Singh, who is currently an assistant professor of ophthalmology in Department of All India Institute of Medical Sciences, Rajkot. Dr. Sugato Paul, consultant eye surgeon at Amulya Jyoti Eye Foundation, AMR Eye Hospital and Sunetra Eye Care Hospital, Kolkata. And Dr. Archana Kumari, who is director, head of the retina department in Prasad Eye Hospital, Ramgarh, Jharkhand. Thank you, each one of you, Dr. Mamta, Dr. Sugato, and Dr. Archana, for being with us in this season as well. Well, money maketh the mayor go is an old saying, and such mega projects are not possible without a strong financial support from our pharma partners. We are indeed extremely thankful to His Highness team, Mr. Surya Narayanan, Mr. Naresh, Mr. Kaustuv, for their support and pushing us to start this season slightly early. I would fail in my duties if I don't acknowledge the field force of His Highness, who have made so much of efforts to enroll all the postgraduates from across the country. Smooth and flawless execution of Brain Teaser platform. All the credit goes to the Numerotech and team headed by Mr. Sai. Thank you, Sai, and your team. And of course, last but not the least, my sincere most thanks to Dr. Shilpi Narunaure, who is my quiz master and co-host of this particular season as well. And she's a established vitreoretinal surgeon of great repute from our own team. Thank you, Shilpi, for being with us. And over to you, Shilpi, to introduce the teams with the rules of the game.
So thank you, sir. So welcome back all the teams to this second episode of season 5. And as you all know, our today's quiz masters are Dr. Mamta Singh, Dr. Sugatopal, and Dr. Archana Kumari. So let's see what's the format of the quiz. So in total, we will be playing 6 preliminary rounds. And today is the second episode. And what is the criteria for qualifying for the quarterfinals is the best performance of the 4 prelims. Out of 6, we will count the best of the 4. So if you have missed any of the episode, don't worry. You can still play and you can compete for the quarterfinals qualifying rounds. So for the quiz, we need 2 platforms. One is the Kahoot platform and other is the Zoom. The first screen is the Zoom platform for live quizzing, while the Kahoot is to answer the questions. I request all the mentors to log in from the separate screen only on the Zoom platform. So this episode has 6 sets of MCQs. Each set will have 5 questions. You will get 10 seconds time per question to answer, and there is no negative marking in today's episode. So these are the prizes for the postgraduates in the finals, while for the audience or the private practitioner, we have 5 prizes per episode. So without wasting much time, now I request Dr. Mamta Singh to take over. She is the assistant professor in ophthalmology at AIIMS Rajkot. To her credit, she has best poster presentation at Asia Pacific Ocular Imaging Society in Singapore 2020. Dr. Anjani Kishore Gold Medal for Best Video in 2019. Dr. D.K. Bose Gold Medal Award for Best Paper in 2018. Dr. Ajit Sinha Gold Medal Award for Best Poster in 2018. And she has to her credit the multiple index publication and chapters in the books. So with this, I hand over the screen to Dr. Mamta ma'am.
Thank you, Dr. Shilpi, and thank you, Prashant sir. Thank you, Sai, and a very good evening to all of you. Welcome to this quiz, and I will be the first host for the evening, the first quiz master. So we'll start with first session. Am I audible, Shilpi? Okay.
Yes, ma'am. Yes, ma'am.
Yeah, fine. So here goes the first question for all of you. Recently, FDA approved drug for dry eye disease, a coltramon ophthalmic solution, is used in concentration of option A, 0.003%, option B, 0.03%, option C, 0.5%, or option D, that is 0.3%. And your time starts now. Time's up, and the correct answer for this question is option A, which is 0.003%. A coltramon basically works on ocular surface, the cold receptors over the ocular surface, and it gives the cold sensation along with it triggers the tear stimulation, tear formation. So that is how it works. So moving on to the next question that we have here. The common intervention in treatment arm of SCUT-2 trial and CLEAR study is. You have to name the common intervention in both of these studies. Option A is topical steroid. Option B, therapeutic PK. Option C, corneal collagen cross-linking. And option D, topical voriconazole. So your time starts now. Here goes the timer for you. Time's up. And here the correct answer for this question is option C, which is corneal collagen cross-linking. It was both of these study, they actually tried to assess the role of C3R in cases of keratitis. Mostly it is bacterial keratitis. So with this, we'll move on to the next question. Question 3 for this round is, intrastromal concentration of amphotericin B is option A, 0.5 microgram per 0.1 ml. Option B, 5 microgram per 0.1 ml. Option C, 50 microgram per 0.1 ml. Or option D, which is 100 microgram per 0.1 ml. And here goes the timer for you. Time's up. And the correct answer for this question is option B, which is 5 microgram per 0.1 ml. The role of intrastromal and intracameral, both voriconazole as well as amphotericin B, has been clearly defined by the TST protocol by RP Center Group. And basically, we use them in cases of cases not responding to topical medication where we have a clear-cut margin. In those cases only we use. So with this, we'll go to the next question. The question number 4 is, thinnest location of cornea is option A, the superiotemporal quadrant, option B, inferotemporal quadrant, option C, that superionasal quadrant, or the option D, which is inferonasal quadrant. And the clock goes off now. With this, the correct answer for this question is option B, which is inferotemporal quadrant. On corneal topography, we get to see the thinnest location just inferotemporal to the center of the cornea. So that is how it is. So next question for this round is, autosomal recessive corneal dystrophy is option A, Fuchs corneal dystrophy, option B, posterior polymorphous corneal dystrophy, option C, congenital hereditary endothelial dystrophy, or option D, granular dystrophy. And the time starts now. Time's up. The correct answer for this question is option C, which is congenital hereditary endothelial dystrophy type 2 precisely. Majority of corneal dystrophies are autosomal dominant except CHAD type 2, then gelatinous, and then we have macular dystrophy. So with this, we have come to the end of this round. And the next quiz master that you're going to meet for today is Dr. Sugato Paul. Dr. Paul is consultant eye surgeon at Amulya Jyoti Eye Foundation, Manipal Hospital, and Sunetra Eye Care, Kolkata. He is the former trust consultant and director diabetic retinopathy screening, WNL NHS Trust UK. He is the editor journal of Ophthalmological Society of West Bengal. So over to you, Dr. Paul.
Thank you, Dr. Mamta, Professor Mamta rather, for the kind introduction. And thank you, Dr. Prashant and Dr. Shilpi, for making me a part of this fantastic program for the last 3-4 years. Thank you. So with that, I'll start my questions. So what is the first question? What is the ideal concentration of fluorescein in the tear film for ocular surface staining? Option A, 0.02, option B, 0.2, option C, option C is 2%, and option D, 0.002%. Time starts now. So the correct answer is B, that is 0.2. Anything of higher concentration, there is a phenomena called quenching phenomena, where the tidally packed fluorescent actually reabsorb the emitted fluorescent, and that actually masks the fluorescent and can lead to where we can fail to detect subtle staining. So 0.2% is the ideal concentration. Next question is, what is enantiomorphism? It is option A, corneal astigmatism, option B, butterfly loop cylinder, option C is mirror image, symmetry of the corneal shape, and option D, inferior stiffening of the cornea in keratoconus. Time starts now. As the name suggests, in ophthalmology, we use this. The correct answer is obviously option C. We use this as mirror image, and that we mostly see in the corneal topography, also in normal eye, also in keratoconic eye, where the mirror image of the both eye is symmetric. So the answer is option C. Come to the next question. So, which of the following can be caused by glioma in children and multiple sclerosis in adults? The option starts now. Option A is hemifacial spasm. Option B is benign essential blepharospasm. Option C is facial myokymia. And option D is all of the above. Time starts now. So the correct answer is facial myokymia. So essential blepharospasm is mainly unknown etiology, and hemifacial spasm rarely can be caused. Seen in this condition is mainly from the vascular phenomena, whereas facial myokymia is consistently present in glioma in children and multiple sclerosis in adult. So we'll go on to the next question. So, inflammatory lesions such as sarcoidosis involving the third nerve commonly involve which part of the nerve supply? Option A is infranuclear, option B is supranuclear, option C is nuclear, and option D is internuclear. So, very easy question, self explanatory. Time starts now. So the correct answer is A, which is infranuclear. So with that, I'll come to the last question of this session. Which disease should one suspect? Again, a very easy one. In a young boy with optic atrophy, vascular attenuation, peripheral pigmentary losses, seizure, and history of progressive dementia. The option starts now. Usher's syndrome, retinitis pigmentosa, Leber's congenital amaurosis, and Batten's disease. Time starts now. So the correct answer is option D, Batten's disease. These features are all characteristics of Batten's disease. In Usher syndrome, we normally get deafness, sensory neural deafness. Retinitis pigmentosa is a group of disease, sometimes can be present individually without any symptoms, and Leber congenital amaurosis is again, they don't have these features of dementia or seizures. So the correct answer is Batten's disease. With that, I come to the end of my section, and let me introduce Dr. Archana Kumari, who has done her MBBS from Medical College, Kolkata. She shared the same postgraduate institute from where I have done my post-graduation, that is Ramakrishna Mission's Sheva Pratishthan, Kolkata, Vivekananda Institute of Medical Sciences. She has also done her Vitreoretinal Fellowship from Lahan in Nepal and currently working as the head of the retina department and director in Prasad Eye Hospital, Jharkhand, and also in Manipal Hospital at Ranchi. She has been the winner of Manjul Pal Gold Medal for the best retinal surgical video in 2023. I presume it's in Jharkhand Ophthalmological Society Conference. And also, she has authored peer-reviewed publications, and she is very enthusiastic speaker and faculty. And welcome, Archana. We are from the same institute and also same Manipal group of hospital. Welcome, Archana.
Thank you so much, sir. Such a nice introduction, and really, it's lovely, and I'm really happy to be a part of same. We share the same postgraduate institute and working place. So, starting with the questions, first of all, what is in Naprovovac resile? The false statement is A. It is a vector-based gene supplementation therapy. B. It targets RPE65 gene. C. Persons with evidence of viable photoreceptors may benefit more. D. It is not yet FDA approved. Your time starts now.
Arjuna ma'am?
Yes. So the answer for, I think here the options are not visible. So the answer is the false statement is that it is not yet FDA approved. So what is in Naprovac resile is a AAV vector-based gene supplementation therapy which targets, and it is a targeted therapy approved by FDA for Leber's congenital amaurosis. It targets RP65 gene and it is more effective in younger patients who have OCT-based evidence of viable photoreceptors. So the second question, drill. The false statement about drill is A, it is a poor prognostic marker of DME. B, it is a marker of ischemia. C, good improvement on anti-VEGF as compared to intravitreal steroids. And D, it is an irreversible retinal change. So the time starts now. So the false statement is good improvement on anti-VEGF as compared to intravitreal steroids. So a drill is disorganization of the retinal inner layers, and it is a poor prognostic marker, biomarker of DME. It is a marker of ischemia and is considered to be irreversible damage. And most of the studies show that drill improves better with intravitreal steroids as compared to anti-VEGF. So our third question is KF ring false statement is A. It is a golden green ring in Descemet's membrane of cornea. B. Starts at nasal and temporal aspect of cornea. C. It can occur in Wilson disease, biliary cirrhosis. And the last option is decreased ceruloplasmin level is usually an associated feature. So your time starts now. So the false statement about KF ring is that it starts at nasal and temporal aspect of the cornea. KF ring or Kayser-Fechner ring is a golden green ring which is due to copper deposition in the Descemet's membrane of cornea, and it results because of liver diseases and like Wilson's and even biliary cirrhosis. The ring first appears as a crescent at the top of the cornea, followed by the inferior 6 o'clock position, and then ultimately a whole ring encircles the cornea. So now the next question. True about toxic optic neuropathy is A. It is mostly asymmetrical. B. It never presents as sudden loss of vision. C. Amiodarone is an implicated drug. And D. It causes altitudinal field defect. So the clock ticks now. So for toxic optic neuropathy, the truest treatment is here amiodarone is an implicated drug. So toxic optic neuropathy is a painless bilateral symmetrical vision loss. Sometimes it may present asymmetrical, but usually the damage is definitely symmetrical, which can be seen in field effects. And this is a progressive loss of visual acuity. It starts just as a blur at the point of fixation. The perimetry shows cecal or centrocecal scotoma, and methyl alcohol, nicotine, and even imidazole is one of the few causative agents. Next question. Which of the cranial nerve supplying extraocular muscle doesn't pass through annulus of Jin? So it is cranial nerve 4, cranial nerve 5, cranial nerve 6, or cranial nerve 3. So the time ticks. So the answer is cranial nerve 4. This is a very basic one. So this is anatomy. If we go to the anatomy, we can see that through the annulus of Zinn, basically the cranial nerve 3, 5 nasociliary nerve, and 6 passes, but the cranial nerve 4 doesn't pass through the annulus of Zinn. So the next question. Yeah, now there is a commercial break. I'm done with this section.
Yes.
Thank you.
So we are over with 3 sets of MCQs. So now it's time for a commercial break. We thank His Highness team for all the financial support. So this is for episode number 3, so which will be on 7th of January at same time, that is 7:30 p.m. So now with this, we start with the next set of our MCQs. So I request Mamta ma'am again to please take over the screen.
Thank you and welcome back. Moving to the section number 4. The first question for section 4 is, if we have -2 diopter of spherical with +7 diopter of cylinder at 90 degree, it is option A, compound myopic astigmatism, option B, compound hypermetropic astigmatism, option C, simple myopic astigmatism, or option D, mixed astigmatism. And the time starts now. Time's up. The correct answer for this question is option D, that is mixed astigmatism. It is very easy. Actually, we can see one of the meridian is falling in front and one behind. So this makes it mixed astigmatism. Moving on to the second question for this section. Which of the following method uses +3 diopter lens to determine the AC by A ratio? Option A, gradient method. Option B, heterophoria method. Option C, distance fixation method. Or option D, hyperphoria method. The time starts now. Time's up, and the correct answer for this question is option A, which is the gradient method. Here you can use +3 or -3 depending whether the patient is fixating on distance or near, and then we have to measure the deviation. That is how we determine the AC by A ratio. Moving on to the next question. Iris pigment epithelium is option A, surface ectoderm in origin, option B, neuroectoderm in origin, option C, mesodermal in origin, or option D, endodermal in origin. And the clock starts now. Time's up, and the correct answer here is option B, which is neuroectodermal in origin. Other ocular structures, which are again neuroectodermal, are retina, optic nerve, and the epithelium of ciliary body also. Moving on to the next question. Question number 4 for this round is Sun classification of uveitis stands for. Option A, Society of Uveitis Nomenclature. Option B, Standardization of Uveitis Nomenclature. Option C, Summary of Uveitis Nomenclature, or option D, which is Standard of Uveitis Nomenclature. And the time starts now. Time's up, and the correct answer for this question is option B, which is Standardization of uveitis nomenclature. We all know that Sun classification is the most commonly followed classification for uveitis, so we need to be aware of the full form of it. Next question, or the last question for this section is, in Jones procedure, what exactly do we do? We do lower lid retractors, we disinsert them. Option B, we perform it for upper lid ectropion. Option C, it is performed for lower lid ectropion, or option D, here the lower lid retractors are plicated. And the time starts now. Time's up, and the correct answer here is option number 4, which is lower lid retractors are plicated. Jones procedure is mainly performed for lower lid entropion, and here through the skin incision, we first identify those retractors, then we plicate them, and we make a kind of barrier for to prevent the upward movement of the preseptal muscle. That is how we treat the lower lid entropion in these cases. So with this, we have come to the end of this, and next I would invite Dr. Sugatopal. Over to you, sir.
Thank you. So here we go again with section 5, very easy questions. Drowsiness is a known side effect of which anti-glaucoma medication? Dorzolamide, option A, option B, timolol, option C, brimonidine, and option C is ripasudil. The time starts now. So the correct answer is option C, brimonidine. Brimonidine not only causes drowsiness, it can cause dry mouth, dizziness, and in children below 2 years, it can even cause central nervous system depressions. And the effect of these side effects increases in patients who have chronic alcohol intake. So next we go to the next question. So latanoprostein Bunod, which is available in the name of Vyzulta, not in India. All are true except option A is work directly upon the trabecular meshwork cells to induce relaxation and increase the outflow. Option B, it relaxes the vessels within the distal conventional outflow tract beyond the Schelm's canal. Option C is a nitric oxide donor, and option D, it has long half-life. So time starts now. So the correct answer is option D. It has actually very short half-life. The nitric oxide, it donate nitric oxide, which actually relaxes the vessels in the relaxes the trabecular meshwork, and the latanoprostein part act by increasing the uveoscleral outflow as well. But the half-life is very short, so the correct answer is D. So we'll go to the next question. Regarding the mechanism of SLT, which of the following is true? Option A, SLT increases the outflow of aqueous humor via the trabecular meshwork. Option B, SLT reduces the production of aqueous humor. Option C, SLT increases the aqueous outflow via the uveoscleral pathway. And option D, 250 laser burns are required to get effective treatment. The time starts now. It's a very easy one. I'm sure everyone has got this right, and the correct answer is option A. SLT or selective laser trabeculoplasty increases the outflow of the aqueous humor via the trabecular meshwork. So, with that, we go on to the next question. Again, an easy one. In Schwartz-Marceau syndrome, all are true except option A, it has choroidal detachment as one of its component. It has raised diopy along with retinal detachment. It has retinal detachment. And option D, the photoreceptor outer segments and the inflammatory cells are isolated in aqueous humor aspirates in this syndrome. The time starts now, which is false. So the correct answer is choroidal detachment, option A. Now, in this syndrome, what happens in retinal tear, the photoreceptors and the outer segments photoreceptor and the inflammatory cells actually migrate in the anterior chamber, and the tear can cause retinal detachment, and the migration of these cells actually can lead to secondary glaucoma. So this is a condition where there is retinal detachment and the pressure is raised in spite of low pressure as we conventionally get in RD. So the correct answer is option A. Choroidal detachment is not present. So we go to the next question. That's the last question of this section. In a patient with angle resection glaucoma, gonioscopy may reveal all except option A, separation of the ciliary body from its attachment to the scleral spur. Option B, increased visibility of the scleral spur. Option C, there is torn iris process. And the last option is there is marked variation of the ciliary body width in the different quadrant of the same eye. The time starts now. Again, the easy one. So again, it's self-explanatory. The correct answer is option A because all the other things we notice is very common in angle recession glaucoma gonioscopy finding, except for separation of the ciliary body from its attachment to the scleral spur. With that, I end my section. Thank you and welcome Dr. Archana again for section 6. Dr. Archana, please.
Thank you so much, sir. So this is the last section of the evening. To start with, the first question, dye used in retinal interventions for internal limiting membrane staining is number one, a very simple question. So sodium fluorescein 2%, is B, brilliant blue 0.025%, C, triamcinolone acetonide 40 milligram per ml, and option D, trypan blue 0.06%. So the time starts now. So the answer for staining dye is brilliant blue 0.025%. So internal limiting membrane peeling, staining of the ILM is done with brilliant blue 0.025%, indocyanine green 0.5%, but not usually used because of its toxicity, and trypan blue 0.15%, which is more than the one we use to stain the anterior capsule. And sodium fluorescein, it only stains the vitreous, while triamcinolone acetonide stains the posterior hylar fleece and is a negative stain. Next question. Coming on to the second question, all are true about Posner-Schlossman syndrome except A, it is a unilateral or bilateral acute rise of IOP. B, anterior chamber reaction may be present. C, always leads to glaucomatous disc change, and D, angle is always open on gonioscopy. Your time starts now. So the false statement about Posner's-Klassmann is that it always leads to glaucomatous disc changes. So Posner's-Klassmann syndrome, as we all know, is a unilateral and sometimes very rarely but bilateral recurrent increase in IOP with open angle, and here the glaucomatous disc changes ensues only after prolonged raised uncontrolled IOP. So the next question is question third, that is Fuchs uveitis syndrome have A, female predilection, B, toxoplasma is the implicated cause, C, it mostly presents with pain and redness, D, it may have hyphema during cataract surgery. So the time ticks starts now. So here the option D is the correct option. That is, it may have hyphema during cataract surgery. So Fuchs uveitis syndrome has no sex predilection, and it usually presents to the surgeon only as cataract or vitritis. It is strongest etiological theories is cytomegalovirus and rubella virus, and it may result in Amsler's sign, that is hyphema in anterior segment during entry because of during at the time of cataract surgery because of iris rubiosis. So the fourth question is Retter's syndrome. False statement is A. It is more common in male of 20 to 40 years. B. It may be associated with vitritis or papillitis. C. Can be bilateral. D. Can be granulomatous. So the time starts now. So the false statement about Retter's syndrome is that it can be granulomatous. It is always a agranulomatous, unilateral, rarely bilateral uveitis and conjunctivitis is characteristic. At the time of presentation, Retter's syndrome is common in 20 to 40-year-old male. So the last question of the evening, keratoconus, following is true. A, it involves only anterior cornea. B, family history, eye rubbing, asthma, and allergy are risk factors. C, it is classified as mild, moderate, and severe. And the last option is Flesher ring is a subepithelial deposition of iron oxide hemosiderin within the posterior limiting lamina membrane around the base of the cone. So the time starts now. So the true statement is option B, that is family history, eye rubbing, asthma, and allergy are risk factors. So as we all know, keratoconus involves the anterior as well as the posterior cornea. The family history, eye rubbing, and asthma are allergy are risk factors, and Flesher rings is the iron deposit, but it is within the epithelium around the base of the cone and is best visualized in cobalt blue filter. Thank you, everybody. Over to Dr. Shilpi and Prashant, sir.
Thank you, Dr. Archana, for taking us through this last part of it. So, thank you, Dr. Sugoto, Dr. Mamta. It was a wonderful session, a lot of learning even for us as a co-host over there. So, we will be having small chat with the people who have joined with us and the private practitioner category. Whoever are the prize winners, they will be asked to join us on the Zoom platform. So, Sai, are we ready with the computation?
Just a moment.
Okay. So once I joins us, we can have that. Do we have some mentors who have joined in today? Do we have mentors, Sai? Can you identify them? I think I see Dr. Ketki Shah, ma'am. She can join us, please. Madam, you can can you upgrade her? She can join over us. She's a mentor for one of the teams. Do I see other people there? Jay Prasad sir is also there. He is one of the senior most persons who have been following our quiz. Sir, why don't you log in? Do join us for small chat meanwhile. Can we have quiz master was rather the mentors who have logged in on behalf of their team for watching them can just raise the hand. We can upgrade you. Yeah. Sai, you see that hand raised. Can you upgrade him?
Yeah, I'm doing it. I'm promoting it.
Yes, sir. Good evening, sir. Just now
Please
I
join
could
in.
join, sir. Thanks, sir.
Get
Thanks
your
for
video on, ma'am. Please get your video on.
yes, yes, ma'am. Yes, sir. Yes,
Dr. Ketki is mentor of
yes, sir.
which team?
The Elite I team, sir, from Dhule, ACPM Medical College. Yes, sir. We
Thank you,
could
Dr.
join in
Ketki.
time. Yes, sir. Thanks, sir.
Thank you. We are so happy to have so enthusiastic mentors. Naturally, an enthusiast
Uh,
mentor means the team would be fully responsible and they would be fighting hardcore. Dr. Sugoto,
Yes.
Dr. Ketki is a faculty at one of the colleges in Maharashtra. You can have a small chat with her as well. You're muted, Sugoto da. Sugoto da, you're muted.
Yeah. I'm sure your team is doing well, and it's great to see actually, as Dr. Bankul is saying, to have the mentor logging in. It gives a big boost to the teams to see their mentor logging in. And thank you for taking your time out, even in the busy schedule. So thank you. I
Um,
hope you enjoyed the quiz
yes, sir.
as well.
Definitely,
Yeah.
sir. It was my pleasure joining. We could join after 15 questions, but this was the first time we joined. Next time we will be in time and we will definitely work hard for being in the
Thank
quiz. Like, thanks.
Dr. Ketki, ma'am, this is
Mm,
there
mm,
are six
mm.
preliminary round. Today was the
Yeah.
second only, and
Yes,
best
yes.
four performances will be taken into account for considering into the
Okay,
quarterfinals.
final.
Don't worry, tell your
Mm,
team they need not get demoralized. We are still into
mm.
the fray. Today
Okay.
they had some glitches. Let's hope next time they will be more comfortable and they will feel at home at the platform.
Yes,
Thank
sir.
you, Dr.
Yes, sir. Thanks. Thanks, sir.
So, thank you, Sai, for sharing with us the private practitioner category prizes. So, these are the phone numbers. On number 5, today is 8281596669. So, viewers, in the private practitioner category, you can look at the screen. These are the mobile numbers on the screen. So, if you are there, please raise your hand. We can promote you. We would like to have a chat with all the private practitioners who are into the top 5 winning prize winning category. So please do raise hand. We will love to have a small chat with you. Our quiz masters will definitely chat with you. So first is I think 8281596669. Hmm? This is I think then 9061031036. That is Jay. Then we have 93150995559 Sai. Then I think it is again Vinith, I believe. Win, I guess 8447877573. And Q Mandal, I believe, if it is not wrong, Q, please do log in. Please do Sai, can you promote them? Just raise your hands. Sai
I'm
will
already.
we can have a chat with them again. Hmm? Yeah, please do raise your hands. Please log into the Zoom platform and we will have a small chat. Get your videos on. Sai, can you unshare the screen now? Yeah. So Q again. Oh, good. So we will start a small discussion with few of the people. First and foremost, we'll chat with the one of the senior most practitioners who have been following our brain teasers for last 6 seasons. Dr. Jaiprasad sir, welcome once more. You are again into that winning five.
Good
Sugato sir.
evening, Prashant.
Yeah, good evening, sir.
Good
Dr.
evening,
Sugato,
Shilpa,
Dr.
and all
Archana,
the.
Mamta, he is one of the senior most practitioners, pocketing every now and then few prizes. Sir, if I'm not wrong, you are 60 plus or 70, 60 plus. So look at his zeal, especially the postgraduates who are watching us. Even at this age, his quest for learning is infinite, and he every
Very
season.
inspiring. So very inspiring.
So, what do you say, Archana? You
Yeah,
Oh, very inspiring,
Prashant.
actually. Sir, it's very being a mentor, and it's actually you have joined and you actually win prizes, and you sir, are able to answer it. I feel it's very difficult even on being on this side as quiz master. So, sir, really big hats off to you, sir.
Yes, sir. You are
Percentages and all are really difficult, Prashant. But otherwise, general information definitely yes, we can do well. But if you ask me what is the percentage of the drug and all that too, the new generation drugs and all, it's not that easy to remember. Numbers will not come that easy unless you are using it routinely. But whatever it is, it gives us a lot of new information on newer drugs, newer treatment concepts, and also helps us to go back and revise what we have already learned. Thank you so much, Shilpa. Hello. Nice seeing you on this platform. And once again, let us have interactions for the next few months, I should say. Looking forward to the
thank
next meeting, subsequent quizzes. Thank you, Prashant, and thank you, Shilpa. And to all the quiz masters, the questions were a combination of really tough to really easy ones. So that way, I think that will keep us also going. Whenever we have slight depression because the question was really tough, the next question is easy. So then you come up, climb the ladder back up, and go on playing. This really helps, and thank you. And I really enjoy this 1 hour. Thank you, Prashant, and thank you, Shilpa. Have a
Yeah,
nice
thank
evening.
you.
you.
Thank you for your
Thank
feedback,
you,
sir.
sir.
Thank you, Dr. Sugato. Yeah, thank
Thank
you.
you.
So,
Vinit is a regular winner. Whenever I see him in the
Yeah.
IRSI quizzes, I see him going on to the podium to get the prize. So he is a regular quizzer and he's very good actually.
habitual
I
offender.
think you won a prize in the recent IRSI Delhi as well, if I remember.
Yes,
The
sir.
ophthalmoscope we got from. Yeah.
Sir, I
So,
always, last time also I said Vinith is a habitual winner, and few of
yeah.
the kgs on his body weight is all contribution because I contribute to his group. So that's a lighter side, just the other way. But Vinith has been winning across. Now he's a SR at RPC. Even that
Yeah.
I know now so well, and we are so proud to have you, Vinith. अर्चना, ये बंदे के बारे में क्या बोला जाए, आप बोलो.
Yeah, I have actually noted that Vineet does very good. In fact, RPC has a very good legacy, sir. There was a Dr. Tripathi was there, Kaushik, and I used to
Yes.
see that they are really very good in quiz. I sometimes feel that I should learn from them. Sometimes if we get an
Yeah.
opportunity, very good, very nice, very good. Big
And
hat.
Ma'am
Dr.
told
Pranati
Dr. Kaur.
Sahay has now joined. She is a great quizzer as well. Yeah.
Okay. Okay.
Yeah.
Ma'am told Dr. Kaushik Tripathi, so he is just our senior and he has been an inspiration, one of the inspirations here
Yeah,
at RP Center to
he
come
was also
forward
like
and
always
yes,
winning end. No?
he's
Yeah.
by vertical only. We have been inspired by him.
We are
So,
MBBS batchmates, and I always look up to him, like, and that is one of the way, just like seeing Dr. Prashant Bhavanki sir and all, we get inspired and you're like, lage raho. So Gato sir, he came after so long, to India back, and then he came with a flash, and sir is like everywhere. So I really joining these podiums, we get inspired by, such people. Be on this side or other side. It's really thank you so much, Prashant sir, for giving us this opportunity.
Thank you, Dr. Archana. I think Vinith and Q, what I feel is you are always pocketing and not giving opportunity to the new faces, I believe. So the next season, what I'm going to do is to have you on the other side
उनको
of
क्विज
the table.
मास्टर बना दे जी सर सर
करना ही
उनको ही
पड़ेगा
क्विज
क्योंकि
मास्टर बना दे
करेक्ट अगले सीजन में ये विनीत को तो हमें खींचना ही पड़ेगा एंड क्यू एज वेल बिकॉज This is not fair for people, ordinary common people like me, who are also participating. Huh?
So,
Uncertain.
Dr. Q, are you from Calcutta, Kolkata?
Yes, sir. I'm from
Oh,
Kolkata.
okay,
Which
okay,
I'm
good.
a
college?
postgraduate
Where?
from AIMS Raipur and currently working as a senior resident in AIMS Raipur.
Oh,
Oh,
nice to
very
meet
good.
you. Nice to meet you.
Thank you.
Congratulations, Q, once more. This time also you have pocketed. Good. Keep up and keep inspiring other people as well. So, Saib,
सर उनको भी क्विज मास्टर बनाना है अगली बार
ये
सर
अभी Q
एसआरस
का
को
भी
क्विज
टाइम
मास्टर
आ
बना दे
बिल्कुल बिल्कुल.
Yeah. So I
We
would,
will have next time, we will have this young blood also
yeah.
infused into our system.
I'd like to thank
Hello.
Dr. Shilpi. So very well coordinated and I am sure she's the person who is doing all the organization bit along with Dr. Bhankule. And thank you for all the coordination and also both of you for making us part of this program year after year. So hope you all enjoyed. Yeah.
थैंक यू सो
So I
मच सर
think Dr. Prashant has got disconnected. Yeah,
he's there
yeah.
he's there Shilpi is just she takes care of sir every small bit
Everything. Yes,
Yeah,
yes.
yeah. It's so easy, sir,
Yeah.
for us, and really thankful to her. And Prashant, sir, you have bringing us, you have brought us in some mainstream of academics. Especially, when I see everyone here, I think that how Shilpi is able to manage being a VR person, doing so many things, and then she manages so well to carry this quiz forward. Thank you.
Dr.
Sir, you're
Prashant, you're
muted.
muted
You are
actually.
muted. Dr. Prashant, you are muted.
See, Sugata sir, Archana madam, you have added, we have so much praised this girl. Today she will add few more kgs to her weight tomorrow, and then tomorrow she will keep on complaining, I have to lose my weight, I have to lose my weight.
I actually want to thank Dr. Annapurna. At the back end, she is helping me out with all the back end work and everything. And
Yeah.
because really it's not possible for a single person or anyone just to, because we need to screen the questions, do the work, whether it is right, wrong, it should not be a repetition. So that is the one
A big
thing.
hand for Dr. Annapurna.
Yes. So thank you everyone, all the quiz masters for being with us. Thank you, Vinay. Thank you, Kiv, Dr. Jay Prakash, sir. Thank you. We keep your participation of all of you in the private practitioner category stimulates us to do more and have more features to this particular quiz. As we slowly build upon after the preliminary rounds, we will be adding some new dimensions beyond MCQs, rapid fires, and some snake ladder patterns and all those things. So do follow us. So thank you all the quiz masters, Sugata sir, Archana madam, and Mamta ma'am. Thank you once more. Thank you, Saib,
Thank you,
for being
sir.
with
Thank
us,
you.
and His Highness team, so Dr. Mr. Naresh, and everyone. And postgraduates, just let me tell you the next date when we are going to have. So that will be again on 7th of January. That is a week, 2 weeks later, exactly on Wednesday, 7:30 p.m. So we will be logging in. That will be our third preliminary rounds. Once more, let me remind postgraduates, if any one of your friends have not yet played for first two, but still there are four preliminary rounds which are left. So, and it is the best of four. It's the cumulative score of best of four performances which can qualify you for the quarterfinals. So still there is a scope. Even people who have missed out on first two episodes can still log in and join the race. Okay. So till we meet on 7th, bye bye from our end. Thank you. Thank you, everyone. Good night.